Surgeon General Vivek Murthy has declared loneliness an epidemic, and he says a lack of connection with other people could increase the risk for premature death equal to smoking 15 cigarettes a day. Now, the report found even before the COVID-19 pandemic, about half of U.S. adults reported experiencing measurable levels of loneliness. The Surgeon General warns that this lack of connection with people could actually lead to an increase in your risk of heart disease, stroke, even dementia. His report said many young people use social media as a replacement for in-person relationships, and 15 to 24-year-olds had 70% less social interaction with friends when compared to people just 2 decades ago. And joining us to talk a little bit more about this is Drew Martel, who is the Chief Clinical and Training Officer for Foundation 2 Crisis Services. Thanks for joining us.
Thanks for having us.
I think one of the things that we were talking a little bit earlier is from this report is that people don't realize the impact loneliness has not only on your mental but your physical health as well.
Yeah, the research into loneliness is very eye-opening, and it's been well known for several decades. Harvard has carried out a very interesting study called the Adult Development Project that's looked at happiness for nearly 100 years now, and loneliness has repeatedly come up. One thing that's worth mentioning is to differentiate between loneliness and being alone. So you can be surrounded by people and feel very lonely, and on the other hand, you could spend time alone and it can be restorative. So when we're talking about loneliness, we're talking about a sense of connection to others.
And we're seeing less connection these days because of technology, social media. You have your phone or your iPad as your best friend.
Absolutely, and that ranges from how we see youth connecting to how we even connect in the workplace anymore. Personally, at times it even feels intrusive to call someone, kind of like it used to feel intrusive to show up at someone's house without giving them a heads up. Well, it feels that way now with just giving someone a phone call. We're so used to texting and email and using the various apps that are out there to communicate. So we have certainly created an atmosphere where loneliness is more pervasive.
Do we think of trying to solve all the problems? How do you solve loneliness? I mean, you don't just say, get outdoors, you know, meet people. There's more to it than that.
There's much more to it. And again, the emphasis being on a deep connection to the people around you. It's not about the quantity of relationships. It's about the quality of those relationships in your life.
But let's be honest, there's some people who have a very difficult ability to make those type of associations. That's not easy to solve.
It's not easy to solve, and it takes real behavioral changes on the part of the individual. You know, it's as simple as to get to know people, you have to get out and get to know people. And as you mentioned, for people with certain mental health conditions or lifestyle or simply living in isolated geographic locations, that's a major challenge.
That's why it's really important for parents to get their kids involved at an early age. I mean, is that really a key?
I think it's absolutely a key. And I think it's also a key that as we age, we continue to recognize the importance of staying connected across the trajectory of our life.
Drew, thanks so much for joining us.
Absolutely.
We appreciate it. It's worth the conversation just to have the conversation, to be honest. Drew Martel, who's the Chief Clinical and Training Officer for Foundation 2 Crisis Services. Once again, thanks for joining us right now. And